The U.S. has now set a new global record in the pandemic. 1 million COVID cases reported in just one day. That record coming on Monday. Health officials telling us they expected things to get worse after the holidays, and that has happened. The president and vice president set to meet this afternoon with the White House COVID response team. Think about this. It's been barely a month since Omicron was detected in southern Africa and Europe. So why is this variant so contagious? Dr. Rajeev Fernando is an infectious disease specialist, and he joins us now. And Dr. Fernando, what is it about this particular variant that makes it so contagious? Somebody told me it is actually worse and more contagious than measles. And I remember when parents would actually try to immunize their children just by having them in the room with another child with measles before vaccines.
Yeah, good morning. Thank you so much for having me. And we don't know whether it's as infectious as measles, but for me, this is definitely takes the cake for number two in recent times with the virus. So the reason this is so contagious is really because of something what we call the spike protein. Now, if you guys look at the coronavirus, the way it looks, you're going to see a circle and something that looks like the sun. Actually, you're going to see these little spikes, which is what's actually called corona. That's what gives the virus its name, corona, through these spikes. And they have the ability to bind to an enzyme on the human cell better, very tight. And that means it's going to enter the cell quicker and better, which makes it more transmissible. The other thing, of course, is the antibodies in the body. A lot of times it doesn't recognize this spike protein, so it's able to evade the immune response or evade boosters to a certain degree. And that's why we're in this situation with 1 million infections a day in America right now.
Dr. Fernando, when we started out with COVID, some said that if 10 people were in an elevator, 2 of them would walk out with COVID. Then Delta, they said 6 people would walk out with COVID. What is it about Omicron? If there are 10 people in an elevator and I'm one of those 10 people and I'm not vaccinated, do I walk out with Omicron? How many do?
It's a great question. Definitely, this is something what we call the R naught. And the R naught is something what we call the basic reproductive numbers. So the numbers you're giving right now, if one person, if you have an index case who's infected, how many people it's going to infect? So we're talking about 1 to 7 for Delta. And measles, like you pointed out earlier, is one person, the index case can infect about 18 people. For this variant, I'm thinking at least one infected person is going to infect up to 10 to 12 people at the very least. We're waiting on final data, but as a specialist in the field, these are my predictions.
Despite the record infections, we are seeing milder cases and shorter hospital stays, and deaths are going on. Is Omicron milder than prior variants, or is it due to the fact that we as a society are now slowly starting to reach what we talked about earlier on in this pandemic, herd immunity?
Yeah, well, that's a great question. And I think this is really great for the rest of the world. Now, in the US, let's say New York City, for example, more than 93% of New Yorkers have got at least a single dose. Let's look into vaccine global equity or inequity, rather, to compare the African continent. Only 7.5% have gotten a single dose. So, this being so infectious might be able to infect the entire planet and give some element of immunity, and then we can talk about heading towards herd immunity. But that's nowhere on the horizon right now. We still have to follow very closely. But I think this is actually good for the rest of the world because Omicron is so mild. We are going to see these hospitalizations go up simply because of sheer volume of cases. But like you nicely pointed out, the length of stay in a hospital is significantly less. With Delta, I've seen patients in the hospital for 2 weeks, 3 weeks. The average duration of stay right now for Omicron is 3 days.
Dr. Fernando, do Americans understand that when it comes to COVID now, we are the country that nobody wants people to travel from? You know, when Omicron first happened, we isolated ourselves from South Africa and 7 other southern African nations. But now with 1 million infections a day in the United States, who wants Americans traveling overseas?
Yeah, that's a great point you bring up. It's very sad, but I feel a lot of countries around the world are starting to shut their doors to the United States. For example, the UAE actually yesterday brought out a very significant rule to say unless you're boosted, you can't enter the country. And really, that travel ban really upsets me to the Southern African countries. As a disaster medicine specialist, a travel ban should be introduced like yesterday. You should introduce, when you have the thought, you should introduce a travel ban. Now, the US waited about 3 days or so, and once communities spread, that becomes a problem. So once we knew it was spreading in the United States, we knew it was too late for a travel ban. They should have reduced that much easier.
Dr. Rajeev Fernando, he is an infectious disease specialist. I thank you very much for joining us, because what you added is so much perspective. 1 in 18 people being infected by this virus, by the way.